Welcome to Conversations on Healthcare. This week we welcome Dr. Ryan Vega, Chief Officer of the Office of Healthcare Innovation at the Veterans Health Administration, on their new culture of innovation. Now, here are your hosts, Mark Masselli and Margaret Flinter.
President Abraham Lincoln said it best: the obligation of the government is to, quote, care for him who shall have borne the battle and for his widow and his orphan. Today, the U.S. Department of Veterans Affairs operates the largest integrated health system in the country, and running the VA requires a commitment to innovation in order to meet the needs of over 9 million men and women veterans.
And joining us to discuss innovation at the VA is Dr. Ryan Vega. He leads the innovation ecosystem within the Veterans Health Administration, and this initiative is focused on being the catalyst for enabling the discovery and the spread of mission-driven healthcare innovation that advances care delivery and service.
Dr. Vega, welcome to Conversations on Healthcare.
Hey, Mark, thanks for having me.
Well, you know, we have been following the Veterans Administration for decades now and following their innovation. I remember back in the 90s, they had just that incredible focus on innovation. It sounds like it's continuing, and I'm wondering if you can explain to our listeners more about the innovation ecosystem and how it operates and how does it fulfill its mission of changing lives and saving lives.
Yeah, Mark, I think you really gave me the sort of the softball setup by providing Lincoln's quote, because one of the things you see in that is that it's our obligation to care for. And that's really important because that must extend beyond just the provision of healthcare. And so our innovation mission, our innovation engine must be the catalyst and the fuel to making sure that we're thinking about upstream prevention and how we enable downstream experiences that contribute to the veterans' entire whole health and their journey. And we've been fortunate. The evolution of innovation in VA is really sort of a journey, but we're now combined 3 offices. And those offices focus on the ability to really test and validate emerging technologies and solutions using clinical simulation. So you can imagine really thinking about testing a new solution out in an operating room, really understanding the implications on the workflow and then deploying it. We have our another office, our innovation ecosystem, which thinks both about the internal investments that we must make, that's both in our people, our processes, and our technology, as well as how we create opportunities to bring industry. This could be Fortune 500 companies and startups. These could be non-traditional players. How do we bring them into the fold? And then we sort of complete that with our Center for Care and Payment Innovation. And this is really important in healthcare because often solutions are introduced into a market that it's not really fully prepared for, whether that's how you pay for it, whether that's the IT solution, or even practice variation amongst providers. All of that context is incredibly important to understand so that solutions can really create meaningful value for both patients, clinicians, and the systems that care for them.
Well, I want to follow that out a little bit because I was thinking as you spoke, I'm not sure anybody survives in healthcare without having some healthy degree of innovation going on, but every healthcare leader knows that to make meaningful innovation, to sustain it, to have it hit the mark of what you're trying to do, it's hard to encourage and it's even harder to implement and maybe even harder still to sustain. So you referenced the Shark Tank, and I'm not sure everybody's familiar with that concept. Tell us about that idea. How does it work and how does it engage your people and contribute to your success in this area?
Yeah, Margaret, thanks for asking. It's a concept that I actually can't take full credit for because it came about prior to my time. But really, the idea is how do you create a culture where individuals on the front lines now have access to this national opportunity, this national network, where the work that they're doing at one VA has the opportunity to spread across. There's 2 things that are really important about the Shark Tank competition. One, and we get hundreds of applications a year, we really focus and get those down to the 10 that have some level of evidence. So there's pretty in-depth reviews on the practice or the solution. and two, those that really seem to have the most potential for impact for veterans. This doesn't have to just be technology. These can be processy changes. It could be even potential policy changes. But the other piece of this is that our medical center directors and even our network directors, they're bidding on these practices, which means they're going to invest. They're going to put either human capital or even working capital money to get these projects replicated at their site because they see a need. And it's that replication and that willingness and that buy-in that enables us to really test solutions in multiple different markets. Instead of saying we see something at one place, thus it must be everywhere, we really get to test and vet these solutions out. And what you know about any innovation process or life cycle is it's a very narrow funnel when you get to the end. Not everything's going to make it. You need markets. And so you have to sort of create those quasi-markets, as we call them. But this allows us to really energize the front line, to tap into that entrepreneurial spirit. Those individuals on the front line, they're the best position to understand what's needed, what's potentially going to work, because they're the ones actually doing the work. And so Shark Tank has really sort of fostered that both entrepreneurial spirit, and some of the practices we have seen come out of that are not just changing and saving lives in the VA, but they're actually spreading across American hospitals and saving lives there as well.
Huh. You know, I want to pull the thread on that conversation you're having, because you're really talking about culture and vision and entrepreneurship all together. And you've written in the New England Journal of Medicine about the 4 critical elements that support the development and deployment of innovation in a health system. And let's just share them with our audience. Workforce capacity to actualize innovation, an organizational infrastructure that supports integrated, systemic, repeatable pathways for change, an innovative, nurturing culture, and a strategic external partnership and collaboration. I'm wondering how you came to those 4 points, and do you think the VA is meeting them right now?
So I think we came to them by a lot of trial and error, which fortunately, part of innovation is about failing. Now, it's failing forward, failing and learning, but I have failed way more in this role than I have succeeded. And I think you have to sort of find what works. But those characteristics seem to be very, very important for healthcare, partially because when you talk about the human capital, and certainly at the stage we are now, 2.5+ years through the pandemic, you know, we're seeing the toll that not investing in human capital, whether it's in the resiliency or the concerns around burnout, can have on the system as a whole. You need that capacity. You need that human capital to be the not only evangelists, but the individuals who are going to carry the torch forward, right? It's really, really hard, and this is not just true in healthcare, to force some innovation into the market or into practice. The likelihood that that's really adopted or sustained is pretty rare. And so if you're not investing in your people, if you're not giving them the tools that they need to drive the change and continuously investing in their ideas and their solutions, it's going to be really, really hard. And so that then piggies back into, well, how is your culture? It has to be a culture that creates safe spaces to fail forward. Mm-hmm. Meaning a lot of what we do in our innovators network is make large, small investments, meaning we may spend less than $1 million on investing in hundreds of different projects or ideas, recognizing that the majority of them will never mature. But that's not necessarily the point. It's those hundreds of employees that are going through that experience, that are learning new skill sets and how to apply them to problem solving, that grows from 1 year to 100 to now thousands. And so I think we are continuously showing some of the levels of maturation. But really what we've seen since this sort of ecosystem has evolved is a growing, and I use the word sort of lightly, group of evangelists. These are individuals out in the field who are better equipped to solve problems. They're coming up with great solutions, whether it impacts one veteran or millions. They're going to continuously be committed to that mission of the innovation role and how it solves problems today, tomorrow, and in the future for the American veteran.
Well, I think you've touched on a number of very important pieces there, including, I'll just say this is unrelated to my question, but you are such a force for training in the country that you have this natural diffusion, I think, of people who've come through the VA. I think, I forget the percentage, but an enormous number of healthcare professionals in the U.S. did some of their training at the VA. So it's good to know they're getting kind of the vaccine for innovation there. But maybe along that thread, in that same journal piece that you and Mark were just discussing, you wrote that the VA is perhaps an unlikely source for this type of innovative talk. And I'd like to just get your thought on that for a moment. Certainly, I look back and think about who had the electronic health record before anybody else in the country. I'm pretty sure Veteran Affairs had the electronic health record, your patient-aligned care teams, some of your training models for physicians and nurse practitioners and others. So are you saying that maybe because it's VA and people aren't expecting that innovation, that some of your successes don't get the same uptake or spread around the country that they might if they were developed in some of the other major health systems? What's your thought on that? Because we really do see you as doing a lot of leadership and innovation.
Yeah, I think that's the challenge of being in government, right? I think perhaps there's a sentiment or a sense generally that government's slow and inefficient and probably not sort of the beacon of innovation that maybe we associate Silicon Valley or other markets with. And I think it's entirely untrue. Now, I'm certainly biased because of my position, but I do think it's sometimes hard where you have constant drumbeat of information that paints the VA or other agencies in sort of a more negative light. And I get it. That's what's going to drive press or certain clicks, so to speak. But the reality is that if you look at the history, particularly of healthcare innovation and some of the leading research and development, VA has moved healthcare in America and globally forward. We were doing so during the pandemic in the utilization of point of care manufacturing, so 3D printing, and how we were able to create both diagnostic testing swabs, personal protective equipment. We were doing so years and years and years ago when we invented and really deployed the first cardiac pacemaker. So I think that's our history. It's part of our lineage. I think what enables us to truly drive transformation is a commitment to the mission, because I'm not beholden, or I don't have some of the same market constraints that our commercial partners may. And I have clinicians and providers who, whether they're in California, Alaska, or Florida, are walking into a VA hospital or showing up to work every day, united by the same mission. So they're collaborating. So I've got some of the best and brightest minds across the country coming together to solve these problems. When you do that, when you have that infrastructure and that capability, you're going to see innovation that not only changes, in this case, the experience or the care for the veteran, but it's going to spread across healthcare globally.
Thinking about the importance that mission has, and certainly it is part of our collective beacon of innovation that comes out of so many different situations, and we certainly were all put to the test during those early days of COVID. I know our own organization, we were able to set up the second mass vaccination site in the United States, and during that period of time, we saw over 750,000 people who came through our doors. And so we needed to be able to turn on a dime and really reimagine the delivery system. But the innovation ecosystem, you talked about this just a moment ago, really also responded in really remarkable ways. Can you share that with our audience?
Yeah, absolutely. So we've been investing in point of care manufacturing, which is really this idea that you can utilize 3D printing to create almost anything you can imagine seeing on a desktop computer in specific software. And this is dating back to 2014, 15, but really began to pick up steam with the development of our 3D printing network. And that was in place before the pandemic hit. So it really enabled us to leverage the breadth of talent across our VA medical centers that were doing this type of work to really push American healthcare forward in how we can utilize manufacturing in the walls of the hospital. During times of the pandemic, this was really supply chain resiliency and producing materials, but it's really grown beyond that now, so that we're understanding how customized orthotics and prosthetics and personalized surgical instruments, and in the future, actually biofabricating tissue and bone and in our lifetime, likely organs. So I think that's one example of what you saw coming out of the pandemic. Again, the network was in place before, but certainly out of necessity, we were able to really pull together that talent and drive it forward. You also saw small projects that have grown into really remarkable solutions. One I'm really proud of was we had a pilot going on in the Massachusetts area where we were utilizing rideshare, particularly just to get veterans to and from appointments. These were veterans that may have difficulty getting transportation, or a family member wasn't able to pick them up after a procedure, and certainly giving them safe transportation was really important. Instead of just letting that pause during the pandemic because clinics were closed and hospital appointments were canceled, they pivoted and utilized that to actually deliver food and materials and goods that were needed, but veterans who relied upon those services or who were concerned about going out into public just couldn't reach. And then from there, as it sort of went back to its original concept, it really grew. People saw the power of using these types of solutions. And so you saw collaborations and public-private partnerships with Uber Health and partnerships across multiple states where now the impact has just been phenomenal on the American veteran and how we're really creating that, again, that ecosystem that's enabled us to leverage multiple different capabilities from internal and external to deliver a world-class experience.
Well, that is so positive. Thank you for sharing it. And I was thinking as you were talking about some of the 3D printing work, especially, that the new tool, the new object, the new resource is sometimes easier for teams on the front line of delivering care to embrace and adopt than when you get to what can often be harder, which is innovating the way people work together, innovating the way they communicate, the way they share responsibility, the team piece of it. How have you in VA and in your area evolved to engage people, to win the hearts and minds of people, maybe who've been there for a long time, maybe not so long, about disrupting processes and changing things that they've felt were familiar and they've done for a long time? How's that going for you?
I don't think that's ever going to not be a challenge. So innovation is always going to be at odds with initial or existing operations. That's its point. That's whole part of the intent is you're trying to change the way that something is delivered or experienced. And at its core, innovation is about creation of value for your existing customer through some new experience or trying to bring new customers in. I think one of the ways you do that is, at least in mitigating some of the initial sort of resistance, is you have to bring people in early on to the design phase. And what I mean by that is that you can leverage design thinking or human-centered design. And as you're understanding and you're going through how to enhance a particular experience or approach a problem, it can't be about pointing out what someone or some group did or did not do. It has to be this collective desire to enhance the experience. Everybody wants to make things better, but sometimes we're looking at things through very, very unique vantage points. If you don't understand those vantage points, if you don't understand where people fall in the value chain, what you end up doing is creating sort of antagonistic systems. And so it's not about sort of saying, we're going to make your process better. It's really about how do we collectively come together and create a new experience or a new outcome. And so I think it starts by bringing people in very early on to the design phase, to the discovery phase, as we call it. If they're part of the solution, if they're part of driving towards that new experience, generally the resistance is a lot less. It still is never going to be perfect. And innovation, and particularly if you look in other markets, those new entries, those new disruptors, they're not looked at kindly. But that's just sort of a fact of how innovation is. And I'm not sure that it will ever be any different. But again, I think the key characteristics is bringing those individuals, those large, diverse stakeholders into the process very early on makes a huge difference.
And, sort of creating those new experiences and outcomes are so important, and in part because I think the VA is trying to be a force multiplier, right? And really using the partnerships that you've developed and having that spread out. And I'm wondering, if you could talk to us about some of the results of those partnerships that they've had and the impact, the sort of the ripple effect, if you will, out across the country's healthcare system.
Yeah, one that I think really just speaks to VA's role and unique position within the larger American health system is one called HAPPEN. So this was a nurse researcher who was doing great work about understanding how to reduce non-ventilator associated pneumonia. So there's a lot of knowledge and understanding about when patients are admitted to an ICU and require ventilation. But her work had really exposed the idea that something as simple as brushing teeth and reducing the potential bacteria in the mouth for veterans could really reduce non-ventilator associated pneumonia. And that is a project that actually showed really great results at one VA medical center. It got into the Shark Tank, it won. It started to be replicated at multiple different hospitals in multiple different settings. And result after result after result kept showing that, whoa, things are actually getting a lot better. And I remember hearing from multiple skeptics early on who now are saying, okay, I've been proven wrong and I'm glad I have. But it was that ability to sort of replicate in multiple markets, in multiple settings, and continuously get the data that the interest of some of our other federal agencies, folks like the CDC, as well as some of our nonprofit, the American Hospital Association, and other private health systems began to take notice. And bringing all of them together in large teams to say, this is an issue across all hospitals in America. This is potentially a solution. It's pretty inexpensive. And what you started to see was that role as VA is not only sort of the driver, but really the convener. We had the solution. We were building upon the data. We have large populations and access to mass amounts of data where we can really understand things such as, hey, we've got this bundle. Do we implement it for everyone? Is there a way you can better target? And so not only were we informing our own drive and how we're going to do this, but the rest of healthcare can adopt that. So I think that's one where the data has been clear. We've seen a reduction in non-ventilator associated pneumonia, which if you dig down even further, that means that's a reduction in the number of deaths.
That's right.
And it's just clear. And so this is something that I think we're really proud of, because when we brought those partners together, we were enabled to get this solution, this information scaled more broadly across the American health system. And as a result, we're going to see people's lives be saved.
Well, thank you so much for sharing that story. I've read about that, and what a wonderful thing to share with us. So thank you. And speaking of partnerships, many of the people who listen to or watch this program are connected to community health centers or federally qualified health centers. Really, Veteran Affairs and federally qualified health centers, two of the largest systems of care in the U.S. and both very mission-driven. What kind of partnerships exist today between the two groups, and particularly as you've tried to ensure that veterans can get care in their communities close to where they live and work? I know there's been more of a focus on maybe trying to build some bridges there in primary care in particular. So what's the status of those innovations in just partnership these days?
Yeah, Margaret, I'm glad you asked. In the 2018 Mission Act, there's a little provision, Section 152. It's not little for us anymore, but it enabled VA to establish the Center for Care and Payment Innovation. So most folks are familiar with the Centers for Medicare and Medicaid Innovation. This is VA's sort of similar type of office. And the first pilot that came out of the Center for Care and Payment Innovation was called VetSmile. There's a large, and I would say maybe about 1.8 million. I always get the number wrong, so I have to rely upon the leadership. But over 1 million veterans who receive care in the VA, but because of the way that certain statutes are written, don't qualify for dental care. And this was an opportunity to utilize that particular piece of legislation and what's called waiver authority to go to Congress and say, hey, look, if we were to change that particular piece of the legislation and expand access to dental care by utilizing our federally qualified health centers and our academic partners, we could get a larger number of veterans into dental homes. And we know that a huge part of care starts in the mouth. And this isn't something that's controversial, but it also has big impact on your social life, on your ability to get a job and other things like that. So VetSmile started in New York and New Jersey, and that was the principle. Right? It was using the federally qualified health centers, partnering with them to create dental homes for veterans referred through the program. And it's just been remarkable to see that the program's growing. The team hopes to have this scaled across the United States by the end of the 5-year pilot. But you're seeing hundreds of veterans now receiving care, particularly dental care, I should say. A large number, I think it's now over 1,000 different procedures that have been performed. So those federally qualified health centers have been vital to the ability for us to improve that accessibility to dental services. And that partnership through that innovative model has really demonstrated the power of that collaboration. So that's another program we're really proud of. It's been fun to watch it spread quickly. And I think by the time that it's over, you're going to see a new era of sort of what that means for VA and federally qualified health centers to partner. Plus, our academic affiliations, these go back 75 years. Right. So they're vital pieces of the puzzle, not only from the training aspect, but how we deliver care to veterans. So, those three entities coming together has been really fun to watch that mature.
Our health center has had a long-standing relationship with our veterans here in the state of Connecticut and participate in the stand down every year. And one of the most successful parts of 100 people delivering care from our team is certainly the dental program. And we know the importance for so many vets and for the rest of the population as important. Healthcare is expensive, but you're really onto something. I'm wondering if you might give some parting thoughts to those who are just beginning innovation. And I really want you maybe to focus in on those Plan, Do, Study, Act teams, those small teams. They don't really cost a lot of money, but they're really capturing engagement of staff and really trying to have them, as we've talked about earlier, be force multipliers with small ideas. Maybe some advice for that smaller organization who's really saying, I want to do it, I just don't know how to start.
Yeah. So a couple of things. You can never spend enough time in the discovery and the design phase. So I think that is absolutely crucial. It does not cost much to sit down and really understand the problem through somebody else's lens. In fact, it doesn't really cost anything. So I think utilizing human-centered design, really taking that approach and spending as much time as you can really understanding the problem, and that problem from multiple different stakeholders and perspectives generally gets you to a better solution. Not always, but I'm willing to bet that it more often than not will. So that's my first piece of advice. The second is I really think it's important to remind people that value, this idea of value, it's really a dynamic concept. It's not something that's static. You can't say, okay, here's how we define value. And the reason I say that is because, one, it's really hard in healthcare. Two, we've generally looked at it from a cost standpoint, but that's not the case. I mean, what's valuable to me may not be valuable to you. What's valuable to one population may not be valuable to the other. Value is a very dynamic concept. And if we can measure it as such across multiple different domains, things like how accessible was the care, how effective was it, how efficient was it, how equitable was it? These are things that now actually enable us to move beyond just the idea of cost and really start to look at solutions that we can actually deploy at scale that will really begin to bend the cost curve, right? I mean, we've sort of been talking about this for a long period of time. Costs are still going up. Now, there's lots of reasons for that. But I think it's this idea that if we move away from that very narrow, limited lens of value, that you really will find solutions that are going to move the needle. So those two things, I think, are really, really important for teams that are starting.
Well, thank you, Dr. Vega, for all that you and your team and your colleagues are doing to serve our nation's veterans, but also to contribute to healthcare in general in this country. We'll continue to follow your work, and for our listeners, you can always learn more about Conversations on Healthcare and sign up for our email updates at www.chcradio.com. Dr. Vega, again, thank you so much.
Yeah, thanks very much for having me.
That's great. Continued success, and we'll continue to follow your work and spread the good news.
It's very exciting.
Thank you.
All right. Take care.
Bye-bye.
Thank you.